Congratulations on your decision to incorporate air polishing into your practice. Follow these steps prior to using your polisher. The outer wrapping of the package contains the instructions for the use and maintenance of the air polisher. Please read prior to use. For future reference, keep instructions in a safe place. Review the contents of the air polisher package. Enclosed, you'll find the air polisher body, 2 autoclavable nozzles, and a cleaning kit. The cleaning kit containing 3 different cleaning wires, 2.5 centimeters, 8 centimeters, and a 10 centimeter. These sizes are to assist you in cleaning all the various air and water passageways inside the tips and the air polisher body. Additionally, there are various gaskets and a replacement cover for the powder reservoir. A sample bottle of Bosworth Profi powder is included for your use. Please fill out your warranty card and return to the Bosworth Company. Your warranty is valid for 1 year from the date of purchase. Let's get your Bosworth air polisher ready to use. Sterilize the nozzle prior to first use by autoclaving at 121 degrees Celsius, 250 degrees Fahrenheit for 30 minutes and allow the nozzle to dry for 15 minutes. Set the dental delivery unit's air pressure to 65 to 70 psi. When set to the correct air pressure, the unit will emit a steady stream of air, water, and Profi powder. This is optimum in order to operate the air polisher properly and to avoid clogging. The air polisher easily connects to most 4-hole handpiece connections. If needed, adapters are available for the following systems: Cavo, B&Air, NSK MAC-QD, NSK Timax, W&H ADEC, and Dental Ease. Clean the ports of the powder chamber before filling using the cleaning wires and blowing them out with air. Wipe and clean chamber out, after which fill the chamber with Profi powder. Do not fill past fill line. Use only sodium bicarbonate. Place your cap back on the reservoir, being careful not to cross-thread or to turn the unit upside down. Lastly, tighten cap, but do not over-tighten. Make sure no air escapes around the seal. Bosworth Profi powder is recommended for use with the air polisher. Available in a convenient 10-ounce bottle or 3-ounce tri-pack. The air polisher operator and the patient should wear eye protection. Utilizing the appropriate evacuation, apply pressure to the pedal while holding the polisher right side up and rotate the nozzle. Direct the air polisher tip towards the surface of the tooth in small circular motions until the surface is clean of stain and plaque, and avoid directing the stream at any soft tissue. Repeat on each tooth. Nozzle rotates 360 degrees. Warnings: avoid prolonged polishing of root surfaces. Air polishing is not recommended for use on patients with exposed cementum or dentin. Do not direct the slurry stream directly towards the margins of restorations. This unit is powerful and can injure the gums if directed at soft tissue. Do not shake the air polisher or turn it upside down, as this will cause clogging. Clean the air polisher after each use in order to assure that all of the air and water ports are clean and dry, as well as clog-free. Empty the reservoir of any remaining powder and discard. Blow out the chamber with air. Insert the appropriate size cleaning wire in each air and water port, making certain they're clear. Thread the wire or orthodontic wire into the nozzle. Always keep powder chamber dry. Do not leave any cleaning wires in the nozzle during autoclaving. Do not autoclave if the nozzle is clogged. Clear clog first. Before sterilizing the air polisher nozzle in an autoclave, make sure that all ports are clear of clogs. Utilize cleaning wires. If you discover a clog, soak in vinegar or warm water for 20 minutes or until the cleaning wire can clear the unit. After clearing the clog, Rinse the entire unit thoroughly with hot water inside and out, including the powder reservoir. Then reassemble the unit and with air only, blow out the air polisher, making sure that all the ports and nozzles are completely clear and dry. Wipe the air polisher body with a disinfectant wipe. Never autoclave the main body of the unit. Place the nozzle in an autoclave bag and then autoclave at 121 degrees Celsius, 250 degrees Fahrenheit for 30 minutes. Allow a 15-minute drying time. After sterilization, make sure there is no moisture in the nozzle by blowing air through the unit to avoid powder solidification in the air ports. Reassemble the air polisher for next use. There are some cautions you should observe when using the air polisher. Shaking the unit may cause clogging. Avoid turning the unit upside down while using it, as this will cause clogging. Rotate the nozzle and not the air polisher. Always keep the powder reservoir dry. The optimal air pressure is 65 to 70 psi, so have your favorite service technician to set appropriately. The patient and operator should use eye protection while air polishing. Patients wearing contact lenses may wish to remove them during the polishing procedure. Prolonged polishing of root surfaces is not recommended. Air polishing is not recommended for use on patients with exposed cementum or dentin. Do not direct the slurry stream directly towards margins of restorations. This unit is powerful and can injure the gums if the stream is directed at soft tissue. Always keep the unit clean and dry. Suggestions. The optimal air pressure is 65 to 70 psi, so have your favorite service technician make the appropriate adjustments. Always keep the unit clean and dry. Disinfecting and assuring nozzles are clear should be part of your routine room turnover procedure after each use. Please do not wait until the end of the day to complete this preventive maintenance on the air polisher. Following proper maintenance will ensure proper operation. Troubleshooting tips. If your air polisher becomes clogged, we recommend the following steps. Step 1. First, find where the clog is actually located by removing the nozzle from the air polisher body and seeing if you have air and water exiting. If you do, then the clog is located in the nozzle. Tip 1. If the body is clogged, fill the reservoir with hot water for 5 minutes and then remove water. Dry thoroughly with air and reassemble the unit. Tip 2. If the nozzle is clogged, use your cleaning wires to remove the clog and/or soak the nozzle in vinegar or warm water for 5 minutes. We recommend soaking the nozzles as described at the end of each day so they're ready for the next day. Tip 3. Check the air and water pressure on the dental unit to make sure they're set properly. A good water spray is very important, and the air pressure should be between 65 and 70 psi. For more information, visit Bosworth.com or call 800-323-4352.